It is certainly an honor to stand here before you to introduce and present House Resolution 780. House Resolution 780 urges the federal government to allocate more funding toward finding a cure for Lyme disease, encourage the Illinois State Board of Public Education to begin health education on tick-borne disease, and also declares May 2022 as Lyme Disease Awareness Month. Before I go any further, I want to introduce to you, some of you may recognize her. Up in the gallery is Jennifer Russell. She is the Executive Director of the Illinois Lyme Association and has been very active in helping to pass legislation in Illinois. We presented back in the 100th General Assembly, House Bill 4515, which presented, and the bill was named after her daughter, the Lauren Russell Lyme Disease Prevention Protection Law, which provided immunity to doctors to treat Lyme and also set up a task force within IDPH. Additionally, in the 101st General Assembly, with her help, we were able to pass HB 889, which mandated insurance coverage for state-regulated insurance plans to allow for longer-term treatment, including IV for Lyme patients. A few statistics on Lyme disease and how it's growing rampant here in the state of Illinois. The data shows today an average of 34%, or 1 out of every 3 ticks is infected with Lyme disease. Lyme disease has been detected in deer ticks in 36 counties. To compare Illinois to New York, where New York is considered an endemic state, we're at 36 counties, and 34% of our ticks, where in New York, 30 to 50% of the ticks carry the disease. Illinois' highest county is Winnebago at 66%. Joe Davis and Putnam counties are at 59% infected of those deer ticks detected. Through the task force efforts, the Illinois Department of Public Health has established an absolutely fantastic interactive map where you too can track your county on where they stand with Lyme disease within Illinois. The intent of this map and the intent to illustrate the number of percentages of Lyme cases within each county or those ticks tested is to educate doctors. You may recall where we talk about Lyme disease as one of the most under-detected, under-identified diseases, where if a doctor can go to that map and see that 66% of the ticks infected within his county carry Lyme, then that maybe should be something to look at. Additionally, I have legislation I introduced early in the General Assembly to add a veterinarian to our task force who actually works with small animals, because what we learn is a correlation between the number of ticks in a area is very much close related to the number of pets that those veterinarians teach or treat. So once again, I ask for a favorable vote on House Resolution 780. And I already introduced Jen Russell, and she's still standing there, but thanks for being here, Jen, and thanks for your work on this too. So with that, I ask for an aye vote.